Good afternoon. Thank you so much for coming to Dr. Adams' dental clinic today. I appreciate you coming very, very much, and I'm going to make this experience for you just as gentle as possible. I know that coming to a dentist is never fun, and I know that you have anxiety about this, and I'm going to do everything I possibly can to make sure that your anxiety level goes way, way down. I myself don't particularly like going to a dentist, and that's what actually made me be a dentist. And so I'm very gentle, I'm very soothing, and I will stop anytime you feel like you're getting uncomfortable, and I will make sure that everything goes as smooth as we possibly can. So my assistant has already got your x-rays, and I took a look at your x-rays, and it looks like you have a couple little tiny cavities in the back, but I'm going to go ahead and check those a little bit better for you. And then once I get those all checked out, then we're going to discuss what your options are. But I just wanted you to know that you have beautiful, beautiful teeth, and everything is going to be fine. I'm going to fix them up, and you're just going to have a wonderful, wonderful smile. So let's get started. Do you have any questions for me right now? We're not going to do the fillings today. We're just gonna put that off until I see everything that's going on in there, because I don't like to rely just on the x-rays. I like to look, myself and feel around in there and make sure that everything is exactly how the x-rays are showing. So we're not going to do the fillings today, especially since this is your first appointment. And after I'm finished, then I'm going to call in my hygienist, and she's going to come in and she's going to give them a really good cleaning. And if you want me to stay in the room while we do a cleaning, I'll be happy to do that as well, but she's awfully gentle as well. So we're not going to do the fillings today. Oh no, you're not going to have any extractions whatsoever. They're just a couple minor fillings, and I know on your paperwork you said that you might want to consider some veneers to just straighten out the two that's in the side that's a little bit crooked. Yeah, and we can definitely discuss those and see if that's an option for you. I personally think that they look, pretty healthy and pretty good, but we'll definitely take a look at that option and what other options you might have as well. Okay? Okay, well, let's go ahead and get started. I'm just going to ask you to open your mouth up really wide so I can just look in there. Perfect. That's perfect. Yeah, just open up, and I'm just going to take my little tool and I'm just going to look around a little bit and see what's going on in there. Perfect. Yes. The front ones look pretty good. There doesn't seem to be like anything. You don't have a lot of calcium built up. Right. What's that? No, they actually look really good. You don't have a lot of tartar or calcium built up, which is really great. Right. Okay, let me check. I'm going to just check the bottom real quick for you. If at any time this gets uncomfortable, you be sure to let me know, okay? Okay, great. I'm going to go back up on top for just a minute. Okay, you have a little bit of tartar built up on the top and on the sides, and a little bit on the inside of the bottom. So I'm going to go ahead and I'm going to get that cleaned up. I'm just going to take this little tool and I'm just going to scrape that off real nice for you, and it's just going to clean that off really nice, okay? Okay, and if any time it gets uncomfortable, you just let me know, sweetie. Okay, and we're going to start on the bottom. great. You're doing great. You're doing very good. Do you want to go ahead and spit for me, please? Let me get you a little cup to spit in there. Yep, just spit right in there. Good. Thank you very much. Okay, now we're going to go ahead and we're going to go on the top, okay? Open real wide. Perfect. Great. Okay, go ahead and have you spit again. Yep, just spit right in there. Good, good job, honey. We're almost done. Good job. Very, very good job. I'm just going to take this and wipe some of this off for us. Perfect. Okay, open up wide. Thank you. Perfect. Good job, sweetie. Very good job. These up real well so that the hygienist can come in and just polish them up nice for you, and you're going to have nice white teeth. That's perfect, sweetie. Okay, I'm just going to spit one more time. Perfect, perfect. Okay, now just open up real wide. I'm just going to feel around in here with my finger a little bit, just to make sure there's no rough edges. Good job. Good, good job. Yeah. Okay, there you go. Very good, sweetie. Okay, that was wonderful. You did an awesome job with that. Thank you very, very much. What I'm going to do now is I'm going to go ahead and send in my hygienist, and she's going to polish these up real nice for you. And once she's all done with that, then we're going to meet back in my office, and we're going to go over the options you have as far as your veneers or whatever else you might like, okay? Thank you very much. And make sure you see my secretary on the way out, because we're going to have to do a follow-up appointment for you. Right, right. Yes, because we're going to have to go ahead and schedule the extractions. So I'm sorry. Oh my goodness, you're not having any the fillings. We're going to have to do some fillings in those back. So I'm going to go ahead and set an appointment for those. So just make sure you see my receptionist on your way out, and we can schedule your fillings for probably a couple weeks. And if you have any problems with anything before then, you make sure you give me a call. Okay? Great. Okay, thank you very much. Nice to meet you. Bye-bye.